Hola, hola a todos. Hi, everybody. So we're going to switch to English now because today we're going to have an amazing guest. We're going to do a quick Instagram live and we're going to talk about something we really like. Look what is happening here. Of course, we're the simulator. Cornea Papi is here with us already, the best cornea surgeon in the world. So we're going to have Dr Ifantides. It's a great colleague. He's gonna join here, and we're gonna here he is. So Christos, just give us there you go. He's soliciting to enter. Very quick, very quick live about what's happening here. Something great is happening. We're gonna talk about future. Hey Christos, how are you?
Good, Ivo. How are you?
Okay, so I'm gonna do a quick introduction for what's happening today. At least you can see my setting, of course, with the simulator, and then we have something funny. Look, we have Cornea Papi, and Cornea Papi is here with us. We have mentors from all over the world, and we have a board, and we are giving a class specifically about irrigation aspiration level 5, that is very difficult. And we also have right here, I'm gonna turn the camera, and we're gonna have a ophthalmic consult. So Christos, tell me a little bit about that. We were discussing a couple of weeks ago about what's gonna happen with ophthalmic training in the future.
Yeah, well, that's the dream, right? So thank you again for the invitation to come to Ophthalmo University a couple of weeks ago. And we were chatting about this idea of what virtual training will look like in the future. You could see here a student doing some virtual reality training over there. An amazing place. I was blown away by your setup, and so I think that's really the future. But we were talking about this idea of at what point in humankind's future will we reach a point where the simulations will have such high fidelity that our computing power will allow for these high fidelity clinical scenarios where there is very little difference between walking to an ophthalmic operating room in real life versus through a simulation. And we could probably agree that based on the way computing power is going, in 200 years we'll definitely be there. But it's probably going to be a lot sooner than that, right? We're probably going to see that happening in the next decade or two with the way computing power is going. So thinking about that, working backwards from the future and saying, okay, in 20 years, we'll have the computing power to have a high fidelity scenario where somebody can walk into an operating room virtually, have their vital signs go up, your heart rate's increased as a trainee, there's a stressful situation. We can try and recreate these high fidelity scenarios. And thinking back from that standpoint, what do we need to build? What technology beyond just computing programs or processing power do we need? What does haptic feedback look like? The biomechanics that we need to start studying now for ophthalmic surgeons' hands so that we know what excellent outcomes can be in the future. But imagine walking into a virtual clinical scenario. Your residency and my residency, we waited for pathology to come to us, right? We waited in the clinic. And now as a teacher, I wait for a certain type of patient to walk in before I can teach a resident what to look for on an exam. Imagine a high fidelity scenario where you can walk in, have a conversation, and then look through the oculars, and then that opens up a world of pathology. We can be training within, let's say, one day you can see 100 high yield pathology cases using virtual reality or on real people to transition into the clinic, augmented reality that can overlay different signs that you should be looking for onto a patient's eye. Those are the future tools that we'll need to accelerate education, because if we can show 100 cases, not just on a computer screen, but through a slit lamp you look through and it's a virtual world, imagine how many eyes we can look at throughout the day, teaching points we could do. We don't have to wait for pathology to come to us anymore. We can have it on demand, so that all those beautiful resources that are online right now, from whether it's the AAO or it's ASCRS or the Moran Corps or University of Iowa, we can come together, create these virtual platforms to create a high yield learning environment. I mean, we can decrease training time significantly, but it's that idea of when will we reach that processing power to create this beautiful high fidelity situation, and then work backwards. What kind of instrumentation will we need to use? And you're doing it there, right? These are the beginning steps of what we are needing to accelerate education, to, using that term, democratize ophthalmic education. We can be training people much faster, much more efficiently, giving amazing feedback. That's the future. And working backwards from what the future looks like, who can we work with? Who are the stakeholders to say, these are the doctors that are understanding what we need. These are the teachers. These are the industry contacts where we can go to and say, this is what we need. Can you help us build it? And that's what you've started there.
I agree so much. I basically love your idea, Christos, of going to the future, see what's going to look like with the ophthalmic training, and then come back. And right here, what we're trying to do is exactly that. Just I will add. You said train somebody more efficient, faster, and also with a much more safety to other human beings. Correct. So basically, what we want, and when we saw the metaverse universe, where people see sometimes something that's going to be risky and it's going to be difficult for other things, I think for ophthalmic training it's going to be great, because think about you guys being here with me, but physically here with me, with a simulator. Right here we have mentors from all over the world, as we were watching. Somebody drawing something that is so simple, but here, for example, we were reasoning how not to traction cortex in places where you have a seminar weakness, for example. This is something so simple, but when you draw it, you can understand. And look at here, look at this environment. Look, to talk about how we classify cataracts, to have the own Ike Aglet with his book, but in a virtual way, training us. We were talking about something that I love. It's the deliberate practice concept, about just isolating the skill, training with focus, but at all times having feedback, subjective and from a good mentor. So, and not only this, you said it, Christos, it's not only about surgical teaching, but if you come with me in this virtual space, we could have all the pre-op, as you can see here, the pre-op studies, so you can do the iron calculation, microscope specular. You can do all the stuff with all the machines, with artificial eyes, as you can see here. We can plan also, not only virtually, but with the bionic eyes, all that reality. And most of all, you said it, how we can go to a simulated, look at here, we can do a simulated ophthalmic consult. And then we can, you don't wait for pathologists, right? Pathologists will come to you. So thank you so much for being here with us, Christos. Good luck in New Orleans, in the great academy. And well, this is only the introduction of what we want to do for the future, right?
That's exactly right, Ivo. I mean, you're starting something huge there. I think
we are.
Yeah, that's right. We are. So, but it's the future of education. We need to break out of a model of one-on-one teaching, and we have to use the technology to assist us in accelerating the learning curve. So I think we're going to get there, and we've started it. So thank you so much for inviting me to chat, and I'm looking forward to seeing what's here in New Orleans over the weekend in terms of education at our American Academy of Ophthalmology meeting.
Look at that. I just can't wait to have a student with, as you can see, 9 different mentors from all over places in the world. You can see people from even from Bangladesh, from United States, from Taiwan. No, it's I think it's something that is going to happen in the near future. Thank you for being here with us, Christos.
Of course. Take care, Ivo.